Hello, I'm here today to inform you about the genital human papillomavirus. It's the most common sexually transmitted virus in the US. Almost every sexually active person will acquire HPV at some point in their lives. What is HPV? It's a very common virus. There are about 100 different types of HPV. 30 of these types affect the genitals, including vulva, vagina, the cervix, penis, and scrotum, as well as the rectum and the anus. Of these 30 types, about 13 are considered high risk, which lead to cervical cancer. So how common is HPV? It is such a common virus, according to the American Cancer Society, that some doctors think it's as common as the cold virus. In the US, over 14 million people get a new HPV infection per year. About half of those, 49%, are new infections in young people, ages 15 to 24. Nearly all sexually active men and women will get HPV at some point in their lives. This is true even for people who have only had sex with one person in their lifetime. So who's at risk of HPV? Anyone who's sexually active. So what's the association between HPV infection and cancer? According to the National Cancer Institute, high-risk HPV accounts for approximately 5% of all cancers worldwide. However, most high-risk HPV infections occur without symptoms and can go away within 1 to 2 years and do not cause cancer. Some HPV infections, however, can persist for many years and lead to abnormalities and lesions that, if untreated, progress to cancer. Which cancers are caused by HPV? Virtually all cervical cancers are caused by HPV, with 2 types of HPV being responsible for about 70% of all HPV cases. Also, anal cancer at about 85%. So what are the statistics of HPV and cancer? Well, approximately 79 million Americans are infected with HPV, which means that nearly all sexually active people will get HPV in their lifetime. Other cancers caused by HPV in the US each year are vulvar cancer, vaginal cancer, penile cancer, anal cancer, and throat cancer as well. About 21,000 of these cancers can potentially be preventable with the new HPV vaccine. So how can HPV be prevented? Well, using condoms every time you have sex can help to reduce your risk for HPV. Being aware, however, condoms do not cover all the genital skin, so they are not 100% effective in the spread of HPV. Women should have regular pelvic exams and pap tests to look for abnormal changes in their cervix that might be precancerous. Basically, if you think you have genital warts or you think your partner has genital warts, do not have sexual contact and seek treatment immediately. So, this new HPV vaccine is the first approved HPV vaccine, and it's called Gardasil. It's approved for girls and women aged 9 to 26. It protects against cervical cancer and genital warts. It also is approved for boys and men with the same ages, 9 to 26. It is best to get the vaccination before becoming sexually active, and it's a series of 3 shots. So after your first shot, you would have another shot 2 months later, and then the third shot would come 6 months after your first. So the only way to really take a look and look out for HPV would be by having routine health screenings. Regular pap tests for women are the best protection against cervical cancer. The tests can detect precancerous changes and cervical cancer. Cervical cancer is almost always preventable and cured if treated early. So while there is no cure for the virus itself, in fact, 70 to 90% of all infections are cleared from our bodies by our own immune system. Some types of treatment could be cytosurgery, the loop electrosurgical excision, electrocautery, laser therapy, and prescription creams. So as medicine advances, and there could possibly be our very first vaccine in the cure of cervical cancer, which is caused by STDs, why not educate ourselves and educate others on this important bit of information? Safe sex is so important, and so is proper education of safe sex. Because HPV is so common, and almost every sexually active person will get HPV at some time in their lives, it is important to protect ourselves against possible health effects of HPV. Thank you.